Quadratus lumborum muscle. In addition to pulling the 12th rib down or compressing the lumbar vertebra, a tight quadratus on one side or the other can cause side bending. It is very important to address these muscles. I'll be covering the back muscles and a lot of techniques on the back in the next segment, but I want to talk a little bit about the quadratus lumborum muscle now, which could be classed as a back muscle or it could be classed as a pelvic muscle. It attaches at your iliac crest in the back and moves up to the 12th rib, with some fibers sometimes going up to the 11th rib. And the importance of the quadratus is that if one side is tight, then it's going to be pulling your body off into a side bend. So if my right quadratus is short, then I'm going to be having strain on the side. It may not be nearly as severe as this, but it can still cause rotational factors on the spine. So it's important to work the quadratus and feel how each side is relative to the other. So if we go into the quadratus area, it's often nice to just do some landmark work and find the crest of the ilium, the posterior ilium here. And then from there, you can picture these fibers of the quadratus coming up to the 12th rib. In reality, a lot of people's 12th rib will be pulled down by these short fibers. So it's also important not only for side bending, but it can be impeding breathing as these ribs are pulled down and unable to move up here. So it's a very, very important muscle to work. This is, in the prone position, is a nice way to work it initially, but it's rather difficult to put much of a stretch. So what I do is I usually do some preparatory work on the quadratus here, and all I need to do is just follow along the crest of that ilium. I'll be doing some cross fiber work here, right on those fibers. Sometimes you just follow that up and you feel this 12th rib here, and you'll feel areas that are fibrosed right up where it attaches there. And so some work right on the ribs is also very important. I almost always just use fingers here. Anything broader is going to be pushing too much down on these floating ribs. Remember that the kidneys lie beneath this area, so you want very specific work here. You could use knuckles, but I think 1 or 2 fingers is probably your best bet to work on this. Just work the attachments all the way along, do some cleaning and some scrubbing, and that's going to relax those fibers in itself just by working on those tendinous insertions. Then you can get into the belly of the muscle. And again, I do cross fiber work. I can then move my body so that I can push this pelvis down and then put them on a slight stretch. There are better ways to get a stretch in this, but this is at least getting you a little bit. So you can see I'm just taking this whole ilium and pushing it down and stretching here. If you're limited for time and can't put your client into the side lying position, these are nice ways to work on the quadratus. One other quick thing you can do is if you move down and grab a hold of the legs, if you take a look at that quadratus area, if I move the legs over, I'm stretching that and opening that up. Now I have this muscle on a nice stretch, so as I'm working with these stretch receptors and redefining their definitions of length. So this is a good way to work on this. Let's move to the side lying position, however, because I think that's by far the best way to work on the quadratus. The side lying position is by far my favorite position to work on the quadratus lumborum. I want you to notice this area right in here where the ilium stops and where the ribs are pulled down, and notice just a feeling of a little bit of shortening in there. And I want you to notice when Dina takes her top leg and just pushes it down and back a little bit, how that area opens. Good. So she can just let her leg just rest on the table there. Sometimes if I put my body here to sort of hold her so she's not going to roll, that's going to work fine. And so now we have this quadratus and this whole area where so many people are short and pulled down, or the pelvis is pulled up. It's nice and stretched. And if I want to, I can just get my nice soft palm of my hand on her ilium and anchor her ribs up here so that I'm not dragging them along, and just stretch this area. I'm really not trying to slide over tissue again. I'm stretching the bony component. I'm really pushing that ilium down, and I'm grabbing the ribs. I'm not sliding over the tissue like this, even though that would feel good. So you can sort of give them a cue about that lengthening there. And then you can start working on this area. Anywhere along here, again, I try to use mostly fingers. Now I'm sort of going along the crest. I can make my fingers nice and soft and then just sink into this quadratus lumborum here. Wait for it to soften. If your client is inclined to help you out, it really helps to have them and watch my fingers and watch this area when Dina helps me out. If I have her reach down through her heel and just stretch that all the way down, excellent, Dina, that's great. And then you can do some almost scooping strokes. You come in and you just visualize scooping this out here. It's a wonderful way to work on the quadratus. Another nice stretch that you can do on this area is with, I'm going to put a drape over Dina because you're going to be imagining that you're working on a client with their clothes off. And all you need to do is get your hands right on top of the crest here. I can even have her accentuate the stretch by reaching up above her head with her other arm. And then you just put your hands over the crest of the ilium here and under the ribs, and pull by pushing off your front leg. I'm not going to be moving my arms and doing a muscle stroke here. I'm going to just be holding this and then pulling down, and maybe even call for Dina to reach up with her arm. That's good. Take a nice deep breath, Dina, and then just let everything soften. Your clients will love this stretch. So just to show you a little bit where this would be without the drape, you just have your arms like this, and you'd push off that front leg and pull this down. They'll walk off the table feeling about 2 inches taller. As long as I have Dina in this position, let's talk about one other way of working on the rotators, and that is to take the top leg forward and bring this one back. So when we bring this forward, we're actually taking the trochanter area here and pulling it away a little bit, and there's going to be a little bit of internal rotation of the leg, which is going to stretch these external rotators. And then all I need to do is find the trochanter here, realize that those rotators are going to be coming right from that trochanter over to the sacrum, and I sink in again and work on those. One of the problems with side lying I want to talk about while I'm working on this, you can watch my hands a little bit and get an idea about how I might work a little more slowly in my actual practice, is that some people are really hesitant to do the side lying because they don't know how to drape. And I have to admit I have an easy time of it. Dina's wearing her bathing suit, and I do Rolfing, and people wear their underclothes with that. But it's well worth it to take 2 or 3 towels and drape this area and work on it. You don't want to skip important work just because it's a little bit awkward. You may even want to tell your client to put on their underclothes so that they can help you out here. It's just such a wonderful position. So I'm very, very deep. I'm working right through those gluteals into the rotators here. Let's take a look at another way to work on the quadratus lumborum, showing you the advantages of getting your client in a different position to increase the effectiveness of your work. As an extra bonus at no extra charge, I want to talk a little bit about some more active ways of working with your clients. I find that this is a very fun way to involve your clients, is to not always just have them lying inertly on the table. So if we take a look at the position of the body now, we'll notice that Dina's leg is hanging over the edge of the table. Her body is in a nice straight line now. It's not leaning backwards or not leaning forward. And you can see what a stretch this gets on the whole IT band. So this is a great way to stretch this area if you want to be actively participating with your client rather than just having them lie on the table. And there's really no trick to it. You can work with just your hands. Basically, the femur is being pulled out of the socket here in a nice, safe way, and we're stretching this IT band. This is very, very effective work. We can soften the IT band as much as we want to, but until we can stretch it, we're not going to have nearly as profound effect on the knee and on the hip and all these other areas. I do most of this in the upper aspect of the IT band. Usually don't go more than halfway down the femur. And in the same position, we can work on the quadratus lumborum area. You can see how this pelvis is just pulled down. We've got a tremendous amount of length here, and all we need to do is just stretch the pelvis a little bit more. We've got gravity working for us, so we can use both hands or we can use one hand to push this down. You can see how I'm lengthening that pelvis, and then you just get into the quadratus and work. Be inventive with your work. It'll make it much more fun for you and more effective for your clients. Have fun and experiment. One of the most important skills you can have as a massage therapist is to be able to hone your skills at recognizing stress patterns with your clients. This will give you a big advantage on planning your strategy for work so that you're working differently for every client. Depending on the breathing patterns, we can have very, very different goals for our clients and where they hold stress. So let's take a quick look at 3 broad and sometimes overlapping models for breath. In the inspiration fixed breathing pattern, your clients will look like they have just taken a large breath and have never let it out. The front of their body will be very, very long, and the back of their body will be short. They will have an increased curve in their lumbar spine, and they'll have a lot of tension in their upper thoracic area and the rhomboids as they pull these shoulders back. So you are going to be wanting to work on these people very, very differently from a person exhibiting, say, an expiration fixed model of breathing. So your strategy for those might be to work downward to give this thoracic area and chest a cue to drop and to level down in this area like this. And you're certainly not going to want to be lengthening the abdomen. The abdomen is going to be very long already. There won't be much need for work on the chest. So you can understand how a breathing pattern can greatly affect your plan as a massage therapist on where you're going to give relief to your client. Let's look at the next pattern, the expiration fixed pattern now. With the expiration fixed breathing pattern, it'll look like your client has just heaved a big sigh and let all their breath out and is having trouble getting that breath filled up into the chest again. So the front of the body in this pattern will be very, very short. The abdominal muscles will be short. And the chest is very often pulled downward and together. Shoulders are even pulled forward. And there will be a pronounced thoracic curve moving forward this way. So your strategies here will be much different from the inspiration fixed pattern. You will probably want to work up the front, give some length to these abdominal muscles so that they can stand a little bit taller, work underneath the costal arch to get some help to the diaphragm here to relax and get some length here so your people will actually be taller when you finish working on them. The back will need softening because they will have been working, these muscles in the thoracic area will have been working to try to counteract this shortness in the front. But you also are not going to want to be adding any length to those muscles because they'll be long enough already. The last breathing pattern I will speak about I call the thoracic breathing pattern. And it's probably a little more closely related to the inspiration fixed pattern that we've talked about earlier, but even expiration fixed people can have this pattern. So basically what a thoracic breather uses are his upper chest muscles and neck muscles to move the ribs up to get breath rather than using the diaphragm. So the areas of tightness will be definitely the sternocleidomastoid and the scalene muscles. And you can tell immediately when these people come in usually that they're very well developed in their anterior neck. And another way to sort of tell if someone has a thoracic pattern is that they will often take a big breath before they speak, and you'll see these muscles tighten up as they continue talking until they're out of breath, and then try that again. So it's very, very important, particularly with a thoracic breathing pattern, to spend a little time working with these people to teach them how to use the diaphragm to fill up the stomach as a breath source, and then have that work as their major source of breath. So as I've just shown you, depending on the breathing pattern that a person may exhibit, you're going to have very different ways that you're going to work on the abdomen. If a person is inspiration fixed and their ribs are pulled up and they're leaning back, you're not going to want to lift those ribs up anymore. If somebody's expiration fixed and their abdomen is short and pulling the ribs down, then you're going to want to move up toward the head to give some more room. So let's take a look at this abdomen. Most of the early classes in massage just do some general, nice, soft, energetic work, which is wonderful work and can really calm someone and actually touch them very, very deeply from an emotional standpoint or an energetic standpoint. But on the other side, after you have a plan, you can be very, very much more specific in what you're doing in the abdomen. I'm going to use a plan to raise Dina's ribs to show you how it would work that way, even though she's in a fairly neutral position. Somebody with very, very short abdomen, a compressed abdomen, you're going to want to raise these ribs up and create some length here. So one of the first things I do, with nice soft fingers, being very careful of the liver beneath the ribs on this right side, I'm just going to go along this costal arch, realizing that all these muscles attach to these ribs. So I'm working basically on the tendinous insertions there and work on both sides. So I might spend a minute or two doing that. I can also, if I feel that her fascia and her chest skin is pulled down into this position, I may want to stretch it, give her some room all the way up above the ribs to have those ribs rise. And I also can take my other hand and come up on her chest and contact those ribs, sink through the muscles, and just give those ribs a cue that they can rise. This is very, very profound work. People will notice this right away. Now you want to be a little careful at the costal arch where it comes together right at the bottom here. The xiphoid process can feel very vulnerable, so you don't want to work deeply on the process or even on adjacent tissue. However, a short rectus abdominis can pull the ribs down, and you can really free these ribs by lengthening these muscles. So I'd work on rectus abdominis from below and just grab that muscle and stretch it. So I'm very much not sliding over this muscle. I'm trying to stretch it. It's not even that important which direction you go. I can move down here, and her ribs are going to hold that muscle at the top, and I can stretch it this way. I find it's a little better to have the legs up when I'm working on this. The muscle can be a little bit more relaxed. So you work all the way down and just grab that muscle one little segment at a time and stretch it. You can work all the way down this way. Some people will hold their tension above the navel, and other people will hold their tension below. Some people are very, very lacking in tension below the navel, and they actually need to strengthen this to stabilize their back. So you wouldn't work inordinately and go all the way down necessarily. You'd work wherever you feel tension. You can work all the way down to the pubic symphysis, and if you're coming from above, it should feel very safe, and you just need to just explain to them that I'm coming down to the lower attachments of your abdominal muscles, and you can work on those fibrous attachments right above the pubic symphysis here. Very, very slow work. Just wait for those tendons to soften. Do your homework first before diving into the deep abdominal muscles. We're going to be talking about the psoas and the iliacus, or the iliacus, depending on how you want to call it, in just a moment. But for now, do your work on those external muscles. Soften those. Another nice way to get a little stretch on the ribs is to take the arm. Whenever I take an arm, I like to take it with a nice broad hand. I have some people picking my arms up like it's an egg that's going to break, and they're very, very pointy. I just like to just grab with a nice broad, firm hold, and I can even take it and hold it against my body here. And I'm going to take my fingers and just wrap them around these lower ribs here. And as I stretch up, I can bring these whole ribs up with this, and this is going to give a real nice cue to lengthen and raise these ribs. And you just wait, go through a few breath cycles. Just wait for that a little bit at a time to stretch. Here we go, it's starting to move now. Remember, somebody with an inspiration fixed pattern that's very tight in their back, you're not going to want to be lengthening them up this way. You may want to stand above them, hold this rectus muscle down, and keep it from raising up when they breathe. So on their in-breath, instead of moving into this pattern, which is their pattern, you hold this down so they learn how to breathe with that diaphragm. So you hold that down, and as they learn that they have to breathe, you're giving them a whole cue about how to breathe differently. Working with the breath can be one of the most rewarding aspects of your work. You can touch your clients so deeply, so quickly, not just from a muscular standpoint, but from an emotional and many, many other energetic levels. Do learn to work with the breath. It will help your clients, and it'll be very, very rewarding for you as well. The psoas and iliacus muscles. Although they share a common attachment on the lesser trochanter of the femur, the iliacus and the psoas muscles have different fiber directions. The iliacus also attaches to the sacrum and can be a factor in sacral dysfunction. It seems like 20 years ago, hardly anyone ever talked about the psoas. It really wasn't considered an important muscle to work on. And nowadays, it seems like probably about 1 out of every 3 people that comes in to see me wants some specific psoas work. So it's a very, very necessary skill if you're going to be doing deep tissue work or any detailed structural work. People come in from their chiropractor, osteopath, physical therapist, Pilates instructor, dance instructor, hairdresser, whoever. People are becoming much more aware of the psoas. And I don't want to make light of this. It is very, very important work, and I recommend that you do learn how to work on this. I will qualify this a little bit to say that a videotape is not the ideal way to learn how to work on the psoas. I can show you some techniques, but you cannot feel my hands working on your body. So I would strongly, strongly recommend that you take a class under the direction of a teacher where you can learn to properly work on the psoas. And be sure in that class that your teacher works on your psoas. When I teach classes with up to 20 students, I'm working on every student's psoas muscle so they can feel what my hands feel like. And I'm actually taking their hands into my psoas and leading them in there so they can feel how to work on my body. So it's very important that you have some standard by which to judge your touch on this. So let's take a little look at the anatomy involved with the psoas. It runs in a vertical direction next to the spine, and it varies. Sometimes people's psoas is as close to an inch to the spine, and other times I feel it 2 to 2.5 or 3 inches lateral to the spine. Travels all the way down. It's touching the transverse processes of the lumbar vertebra. It's also connecting to the bodies of the lumbar vertebra and to the disc. So this is why it's so important that you create psoas balance here. It travels down, goes through the pelvis here, and attaches to the lesser trochanter on the inside of the leg, right in about where my thumb is not quite visible for you here. So on this side, it would be right down about here. Okay, you want to be careful. There are some lymph nodes here. And I do most of the work at this stage by working in the upper psoas rather than at the attachment. Because you don't know how medial or lateral the psoas is, I try to come in at a little bit of a diagonal with both my hands. I feel it's much easier to locate right around the level of the navel. If you start getting up any higher, it's very difficult to find the psoas. So what I come in with a diagonal and my fingers nice and soft and slowly, slowly sink in. One of the biggest errors I see with people when they're learning to work on the psoas is that they're tentative. It's a bit frightening to come in there the first time and work on this. And so with that tentativeness, there's a little bit of pokiness and probing, and you don't want to do that. You want to have a steady, steady sinking until you can feel that psoas down here. And this is why it's important to do that palpation work that we did on feeling the soleus muscle through the gastroc and feeling the rotators through the gluteus. Now I can feel Dina's psoas, and then to just give myself a little bit of information about this psoas, I'm going to have her just lift her foot straight up, and that flexion of the hip is going to, okay, you can put that down now, Dina, is going to bring this psoas, it's going to contract to pull this knee this way, and I can feel it just coming up to meet me as it does that, as it's shortening. That's going to give me some idea. I'm going to also feel as it contracts. Does it jump to the lateral side? Does it jump to the medial? Do I feel some fibrousness in certain areas? And that's going to tell me a lot about this psoas. And that's enough for right now. If this person has not had their psoas muscle worked on before, you want to let them react to this because this is a very, very deep part of the body. The important thing that you want to think about when you're starting to work on the psoas is that your goal is to create balance. You're much better off having 2 tight psoas muscles than 1 tight and 1 overworked psoas that has gotten loose, because that's going to be putting all sorts of rotational torsion on the spine and on the pelvis. So you don't just dive in and start working for 10 minutes on 1 psoas when it might be that that psoas is not half as tight as the other. So then after I've palpated and got a little sense of that first psoas, I'm going to come over to the other side and feel the same. Now I'm going to move a little faster here because I've done this a lot and I want to show you some techniques to work on the psoas. Actually, I feel Dina's left psoas is considerably tighter than her right. Go ahead and raise your knee now, Dina, and back down. And I can just feel there's a little grabbing. It's not raising as smoothly right there. Okay? So I really need to work on Dina's left psoas, but for the purposes of this tape, I'm going to move over to the right to show how it would work. So now that I've decided that this side is the one I'm going to concentrate on, I certainly would work on both sides, but I want to really put my emphasis on the tight side, which we're pretending is the right side. I'm going to sink down till I feel that psoas again. And then I'm going to have Dina very slowly, if you can watch her legs, she's going to keep her left leg up, and her right leg is going to slowly slide straight down. She doesn't lift her leg, she just slides it down. And on this, I'm going to be grabbing that psoas with my hand and lengthening it along that path. If I feel it jumping to the right or to the left, then I'm going to try to keep it lengthening in a straight line. There. And then after she has that leg down there, she can just leave that down there and relax. From there on, I'm just going to sink. I'm going to feel this psoas. I can get my hands on one side and the other of it. I can roll it. The main thing I'm going to do is I'm going to stretch it so that it lengthens and softens. If I feel fibrous areas in the psoas, then I can really do some very precise work. Sometimes it's just training it to relax. Just let your hands sink in there and wait for that melt. Every once in a while, I can just tell Dina to slowly raise her knee just a tiny bit and back down. Any areas that I feel fibrousness in, I'll sometimes call her to move into a little more active mode here. This is work that you should feel totally free to ask your client to move their leg. They're not going to be just spacing out, lying there. They're going to be wanting to work with you here. The other thing I can do now is have Dina raise her knee just a little bit again. And now I can do an anchor and stretch stroke. So I'm going to sink in. I'm going to anchor that psoas up, hold it where any fibrous areas are, and then have her slide her leg down. Excellent. That's really all there is to it. I will mention in more advanced classes, we start talking about positions to extend the hip back farther so that you can get even more of a stretch on the psoas. If I were working on this and really decided I needed to stretch this psoas, I could have Dina slide over to the right, so she's right over to the side of the table here. I just take Dina's leg and stretch it down here. And that's going to stretch this area even more. You can also start working with the other major hip flexor besides the psoas, the rectus femoris here, which attaches at the anterior inferior iliac spine here. So this is going to open up this whole hip area here. I'd like to show you one other way to work on the psoas. This would be a little bit more advanced work for people that have had a lot of psoas work, that are very, very comfortable with having the area worked on. I wouldn't advise doing this the first time you're getting to know someone's psoas. But basically, most of the things we've been showing with the psoas are in a neutral position. And sometimes it really is advantageous to open up that hip flexor area and stretch both the psoas and the iliacus and also the rectus femoris. So if we take a look at Dina in this position, she's leaning way, way down on the table. If she were to actually let both her legs down, she could probably stand up right from here. Her head is nice and relaxed. She's not straining with her neck too much. And I just want you to watch her left hip flexor area when she lets her left leg just dangle down. And notice how this opens up. Can you see now that she's much more open than in a neutral position lying on her back? On the other side, she can keep her pelvis in a fairly neutral position by pulling this leg up. It's very important that you have this leg up and held into a position where her back is supported on this side right here, so she's not getting too much curve to her back. Anytime that this is uncomfortable for the back, then you're going to tell the person to let you know, and you're going to stop immediately and raise their leg up and help them bring it back up. Okay? So now in this position, I've got all sorts of length through this quadriceps group, through the psoas. I can actually work on her psoas in this position and her iliacus. Just get that a cue to get that extra few degrees of stretching. It's also an excellent way to work on the upper quadriceps group, and all you need to do, I'm going to use my fist here to sort of show and keep my body out of the way. I could certainly come and use my forearm, is a nice broad stroke that's just going to open this up. Can you see how I'm pulling those quadriceps muscles down? This is very, very useful. On the other side, you want to make sure that you've worked with this psoas enough time that you know it, and that the person with you feels comfortable working with you. I would never do this with somebody that I'd seen just 1 or 2 times. I would definitely want to see how they reacted to more subtle psoas work. But as you get more and more confident in your work, tuck this away and use it sometime. I think you'll find that your clients really do like this. The iliacus muscle. The iliacus muscle is often relegated to secondary status when working with the iliopsoas complex. Notice the difference in fiber direction between the iliacus and the psoas. Tightness in the iliacus can cause lateral deviation of the psoas and have other effects upon the sacrum. Unilateral tightness can cause torsion upon the separate innominate bones. The iliacus, or the iliacus muscle, depending on which side of the Mason-Dixon line you've been born on, is also another important part. A lot of people just talk about the psoas without considering the fact that the iliacus muscle lines the pelvis and joins that psoas and becomes the iliopsoas, and it's very, very important as well as the psoas. Now, the thing with that is its fibers are going to be running at a little bit different direction like this. And you can really feel a difference as you take your hands with a nice soft touch and roll over that ilium, that crest there. You can feel this muscle, and it can be very, very tight on some people. And its tightness can do things like, because it attaches to the sacrum, on the anterior side of the sacrum, it can be pulling the sacrum one way or another or causing rotational stress. So it's very, very important for balancing the abdomen that you don't just work on the psoas, that you work on the iliacus. So the first thing I do with this is I just curl my hands over and just wait for that muscle to soften. Depending on how that's moving, that may be enough, but very often I'll take a nice soft hand here and then take some strokes cross fiber down that iliacus as it joins the psoas muscle. Just have a nice, flat, soft hand and work. I'm just a little bit below the anterior superior iliac spine here and moving toward Dina's feet. You can even do some stretching by grabbing the pelvis in the front and pushing with one hand and pulling in the other, and just spread this pelvis in the front. Just create some space there. So now I'm reaching across to give you a little idea about balancing on the other side. I generally work on the iliacus on the side where I'm standing because I can get a little softer feel with my fingers. This is very important work. Actually, when I feel her right iliacus here, I feel like it's a bit tighter than her left, so I'm going to create a little balance on her right side here. Can you feel that fibrousness right here? Mm-hmm. I often talk to the people I'm working on. I want to get them involved, ask them what they're feeling. Slow, patient work. Let the work happen. Let the softening happen. Don't try to force it and make it happen. Rarely, but occasionally you'll find somebody that is ticklish when you're working down in this area. And that can be that they're just ticklish. It can be that they're feeling a bit uncomfortable, and it's a way of sort of keeping you out of that area. One thing that I've always found in any ticklish area, if I were working on her left side here and there was a little bit of ticklishness going on, all you need to do is take one of their hands, put it down to work through yours so they're touching the skin themselves, and then that's going to, in all probability, 99% of the cases, will take away the ticklishness. It's like trying to tickle yourself then. That's all there is to it. It's very, very nuts and bolts, no fanciness involved, just work with the tissue. This is when we went back to the very, very beginning of this whole videotape series when we talked about how people in class, within the first minute or two, when we poll them on how well they assume their massage therapist is going to do when they work on them, that the first minute or two you can tell by someone's touch. You want to have a strong, confident, and yet soft touch to instill confidence in your person and let them relax when you're working on this. After you've done your work on the left and the right psoas and the iliacus, then it's important for you to do some balancing work. This is not extremely strong work. It's more recruiting muscle fibers and training her pelvis to work in a uniform and balanced manner. So you've done most of your heavy work, and now this is just educative work. So what I do here is I climb on the table so I can have proper balance for myself, and then I take the nice broad part of my thumbs right about at the level of the anterior superior iliac spine, move in so I've got a nice broad coverage. You might be just slightly above the spine toward the head, and you sink down with these thumbs until you feel the psoas. And even though you've done work with softening and lengthening here, sometimes you'll feel one psoas is maybe 1/2 an inch or even 3/4 of an inch more toward the front. And that can be very, very important on rotational spine issues. So what I try to do is I try to get a little bit of balance. Dina's left psoas is a little more toward the ceiling. So I'm going to actually put about 30% more force on my right thumb right here and sink in. And then I'm going to ask Dina to just turn her pelvis under. That's it. Good. And back. As she turns back, I can anchor those psoases. What I'm trying to work on is that the psoases do not jump to the medial side or to the lateral side, that one isn't doing all the work. If one starts doing all the work and jumping up toward the front of her abdomen or toward the ceiling from where we're shooting this, then I'm going to hold it down so that she has to sort of use the other psoas to recruit it in. So turn that under again. There you go. That's better. Now there's a little better balance there. She was using her left psoas and tilted back about twice as much as her right. So I basically pushed down on that to sort of shut it off, and then she immediately started using her right psoas. And turn that under again. And there you are. Good. And back and relax. It's very important. You've been working very, very deeply here. So you don't just, when you're finished, take your hands out very suddenly. Nice and slowly. Keep your hands on here to keep that energetic connection for a while. And you may even want to just come and put your hand on the abdomen, put your other hand underneath the back, and just do some nice relaxing work here to sort of soften that up. You've been working very, very deeply, so now you want to bring your attention into a more superficial level. Just be nurturing, just be nice to this area. Psoas work can be a little bit too clinical. It's very nice afterwards to just soften up. After this, I often take 30 seconds, a minute, or even longer to let the person come back from this very, very deep place you've been working in their body. To sort of come out, notice the sounds coming back into the room, let that awareness come back into their being. As we start talking about the back, I want to digress just a little bit to some of the fundamental strokes that we've talked about. I'll be going in much more detail about these strokes when we talk about the specifics, but let's just get a little review on some of the biomechanics and some of the tools that are available for you when you're working on the back. Probably the most easy tool that you have at your disposal is the forearm and the elbow. A lot of times I'll use those synonymously. All you need to do is to start raising your hand a little bit to get a little sharper angle if you want to move from a broad forearm stroke to an elbow. Let's get a little bit of lotion on and talk about that again. You'll notice I'm using very, very little lotion here. I think the biggest error that I encounter with new students is that they use way too much lotion, so they're not able to grip tissue. We're trying to work deeply, and we're trying to grab tissue and stretch it and sink through superficial tissue. If you've got too much lubrication on, it's not going to work. Use this time when you're putting the lotion on also to determine what are some of the restricted areas, including how the ribs and vertebrae move. As I'm putting this on, I'm noticing that the mid-thoracic area is not moving nearly as easily as the others. So I'm going to know that I'm going to be spending a lot more time working on the mid-thoracic than I will on possibly the low back or the upper back, depending on where Dina's open areas are. Let's move into the forearm first. Notice that I use the forearm close to the elbow so that I've got some nice leverage, and that I keep the elbow next to the spine. I'm not going to be using my right arm and forearm here because I wouldn't have the specificity if I need to raise my hand and get more direct to get right next down to the spine. If I come to an area that's not moving, I can wait and wait for that to soften. We'll talk in a lot more detail about that later. As I come to the scapula, I can move my arm in such a direction that I'm not going to be sliding over the scapula, but still be using a relatively wide forearm stroke here. If I needed very specific work with my elbow and I was afraid of it slipping, I could just put it in my hand like this and move in whatever direction I want and have it softly stuck right in that little niche there of my thumb and my index finger. If I wanted some very specific work, I might want to move to my knuckles. Great tool here. Just notice how straight my wrist is, and as you move up, my forearm, my elbow is extended. All of my gravity is coming from either me standing above and letting my own body weight do the work, or stepping back and pushing off my feet if I want to work in a little bit more oblique angle. The main key is that I'm going to have my palm of my hand rotated to my right so that everything's in a straight line here. If I start changing this way, I'm going to have a lot of movement and my wrist isn't going to be stable. I don't have to just keep going in a straight line. I can do rotational strokes. These are all the things you might be doing with your thumbs, and you'll be saving your thumbs by using your knuckles. Let's move to the fist here. fist is a nice broad stroke, and you'll notice that my hand is nice and soft. I'm just using these knuckles right across here, right where the fingers attach, and I just take some nice broad strokes here. If you notice my shoulder, it's down low. I'm leaning right through this arm, almost like I'm just leaning on the table. If my shoulder were working way too high, if the table were too high, if I had a very large client, then I've got to make some changes. There's too much strain in my shoulder when it's way up by my ear here. So what I would need to do would be, I could either climb on the table so that I'm now high enough that my shoulder is down low and I can just lean into this. I don't usually work on the other side, but this will just give you a little bit of clearer idea. On Dean's left side. And if that's not working as well as I want, all I need to do is just switch tools. So if I'm straining with my shoulder too high, all I need to do is just lean down a little bit and use my forearm, and I can approximate that feel. Since it's crucial to understand the articulation planes upon which bones move with each other, let's take a look at the spine, which is probably the area that we're going to affect the most. I will be talking again and again throughout this about how to work with vertebra to free up the back. A lot of the muscular complaints that people have are actually resulting from vertebrae that are fixated and stuck. So let's have a look at the lumbar area and notice how these vertebrae articulate with each other. So these articulation points are called facets, and if you look right in here, they articulate at an angle about like this. So that means that the spine can move forward and back into flexion and extension and do that fairly easily, but they're somewhat limited in their ability to rotate because these planes of articulation are about like this. As we move up into the thoracic area and we take a close look at this articulation, the facets here are much flatter and they're at an angle about like this. So my hands are going to be moving like this. And this, of course, enables us to bend forward, to sit up straight, and you can understand why these formed this way. But this is very, very important because if you're pushing on a vertebra directly down into the table, you're going to be pushing these facets directly into each other. So you're going to want to get movement toward the head or toward the feet to start freeing these facets. Up at the cervical area, the movement of the neck is very different from the movement required of the lumbars and of the thoracics. So these facets are at more of an angle like this that enable us to rotate. So when you're working with the bones, when you're pressing on those transverse processes, it's very important that you notice what angle they're articulating with each other so that you can free them up. Let's take a look at some of the aberrations in the way vertebrae articulate with each other next. Let's take a look at some of the problems that the spine can cause as far as rotational deviation. If we look right here, this is the third lumbar vertebra, and you look at the facet here as the third lumbar vertebra articulates with the fourth lumbar vertebra right here, you can see a rather wide space in between these facets. Whereas if you go over to the other side, you can see they're very, very compressed. So what we're going to be wanting to work with here is providing some mobility. Remember, we're not chiropractors or osteopaths or physical therapists. We're not manipulating vertebra, but we also have to realize that tight muscles that are involved with painful vertebra rotation can clamp down on this vertebra and prevent its movement. So as massage therapists, we can relax these muscles and we can work with the transverse processes as long as we work gently and easily and let them move wherever they want to rather than forcing them. So what I might do on this would be, as I'm working, I could be pressing on one vertebra or the other and really working at an isolated, close level. You can notice by pushing up above that I can close this. And I look at vertebrae that get stuck. The muscles clamp down and they go in spasm. I look at that a little bit like a stuck drawer, if you've ever had a drawer in a dresser. And you know that if you try to force it, it's not going to go. But if you just jiggle it and allow it to free and relax and do this in a nice, safe situation, that drawer all of a sudden can start sliding again. And we as massage therapists can provide tremendous help in this area, as long as we don't try to be curing conditions and trying to make ourselves out as adjusters of vertebra. It's our job to work with the muscles, and if the body or vertebrae want to adjust, so much the better. Now that we've covered how facets articulate with each other, let's move to some sophisticated models with state-of-the-art computer modeling to look at the ways that individual vertebrae have gross movement forward, backwards, to the side, and rotationally. So let's take a look at this sophisticated model and get an idea about how vertebrae move upon each other. So here we have some styrofoam that I use in my classes, and I found my students very, very much appreciate this description to give them an understanding about how vertebrae work. So this would be the body of the vertebra, this would be the transverse process, and this would be a transverse process, and this would be the spinous process. So this vertebra is facing just about in the direction that I'm facing. So this would be the right transverse process, and this would be the left transverse process. So the first movement that I would like to talk about is compression. So your vertebrae sit like this with a disc in between them, and as we walk, as we run, or as we bend, they compress into each other. So this would be compression. Now compression, when it's done on one side, such as influenced by a tight quadratus lumborum muscle or a psoas muscle, will then come into side bending. So side bending is actually compression on one side of the vertebra. The next movement will be side glide, and this is most important in the cervical area. There's not a whole lot of ability for your lumbars or thoracic vertebra to slide from one side to the other, but there is quite a bit of movement in the neck available. So this would be just the ability of the top vertebra to move to the left or to the right here on the other vertebra. And this can tell you a whole lot about restrictions on how those facets are working. So this is something we'll be demonstrating with Dina, and I think you'll find this is very, very important. So just to give you another view on this, if your client were laying on their back and the vertebral body was toward the top here, then it would be moving one way or the other like this. It's very important that you understand when we're discussing rotation the definitions of rotation, which would be that it is defined as the movement of the superior vertebra on the inferior vertebra. So when the top vertebra is rotating right, the right transverse process will move toward the rear. So that's very, very important, and we'll talk about this later, and you'll understand why this is important when you're trying to work with freeing vertebra. So if I turn to the left, then the left transverse process will move toward the rear. And please do replay this if you have any questions about this movement, because we're going to get a little bit more complex, and it's very, very important that you're understanding that right rotation will be a clockwise rotation and left rotation will be a counterclockwise rotation. So let's review a little bit about side bending. We've talked about that before. Side bending to the right would be a movement like this, and side bending to the left would be movement like this. And rotation to the right would be movement like this, clockwise, and rotation to the left would be counterclockwise. So it's important to understand that side bending always accompanies rotation and vice versa. So let's look at the cervical area, and this is very, very important for you to understand when you're moving the neck through its range of motion. So if you're going to right side bend the neck, it's going to have to rotate to the right. That's just the way the vertebrae articulate with each other. And if you rotate a cervical vertebra to the left, it is going to side bend to the left. So side bending and rotation in the cervical area are always to the same side. Let me repeat that one more time very quickly. If you're rotating to the right, you're going to have a little bit of right side bending here. And if you're side bending to the left, you're going to have a little bit of left rotation. In the thoracic and in the lumbar, this is very, very different. And this is very, very important, and this is why people become injured when they bend to their right and rotate behind them to pick something up, and why they injure discs. Because in the thoracic and in the lumbar area, if you side bend to the right, that vertebra is going to rotate to the left. So that's going to be the movement. If you side bend to the left, that vertebra is going to rotate to the right. So this is very, very important, and the reason that this is important is you're going to want to be moving vertebra in a position to free them. And what happens is that vertebrae get stuck on each other. These muscles that we're working on not only move the vertebra, but they also lock the vertebra in positions where they can't move. As you can see, these vertebral movement patterns can get very, very complex fairly quickly, and it's way beyond the scope of this video to try to have you come in and start fixing vertebral problems. But it is something that you can really increase your skill with, and of course refer out to chiropractors and osteopaths and physical therapists or anyone else to try to deal with severe problems. These are not for acute problems as much as people that have lack of mobility in their vertebrae. So if you do wish to explore this a little bit further, there's an excellent book out here called Spinal Manipulation Made Simple, a manual for soft tissue techniques by Jeffrey Maitland. And I would suggest getting this book to understand the intricacies of working with vertebrae. So let's take a look at why some of these movement patterns of vertebrae cause problems with our clients, so that you can maybe start working on some ways to try to give some relief to clients when they come in and talk about their back hurting. So the next thing that I would like to talk about with vertebrae is the anterior-posterior glide movement. That's pretty well known. Most of us talk about this in early massage classes, but there are some misconceptions. People feel that when a person moves into flexion, it's just a movement like this, and when you move into extension, it's a movement like this. When in actuality, flexion is always accompanied by forward glide, and extension is accompanied by backward glide. And the importance of this is that as vertebrae slide forward and back, this is the way that they get rotated and stuck, which is why people go to chiropractors. And we're certainly not going to be chiropractors and trying to make adjustments of vertebra, but we certainly can free up the muscular causes of these fixations. So let's take a look about forward glide and how that can influence rotation. So as a vertebra slides forward, if it's unable to slide back, as the person stands up straight, if the right side is stuck forward, you're going to get rotation of that vertebra, which is going to cause pain for the client. Or if it's fixated in the back position and not able to slide forward, if a person tries to bend forward, they're not able to move, and they'll say, I really have pain in my vertebra when I try to bend forward. By the same token, if a vertebra is slid just a little bit too far forward and a person tries to sit up straight and it's unable to slide back, then they're going to have pain when they move into extension. So these are the factors that you want to consider when you're working with your clients. As they're lying face down on the table with their spinous process up here, and you feel one vertebra whose transverse process is stuck back, or you feel a hole on the other side as one is stuck forward, then you know that you may need to start jostling these to sort of free those up. And it's also important to know, we will talk at great length about what position to place your client in. So if you feel that these vertebrae can't slide forward, they're fixated, you may want to put some rotational stress by putting the client on their side so that you can get a little bit of rotation in here. Or move them into a C-curve to have this slide forward and mobilize. So these are factors that we'll be talking about in the body and will be very, very useful to you. So as you can see, this is very, very complex material, but once you grasp it, it's very, very simple, and it can be extremely useful for you freeing up facets in the back. So I would suggest doing a little more research on this. The book Spinal Manipulation Made Easy by Jeff Maitland is an excellent way to go into more detail on this. And we will be working with this in a little less specific ways, because basically all you need to do is, if you understand how vertebrae work, and when you're pushing on the back, as I will time and time again show you, and you notice that a vertebra isn't moving or that a rib isn't moving, if you can start working and know which direction to push that vertebra or push that rib to give it a little more freedom, you can have phenomenal results on working with the back. So do work with this. Realize this is complex, it's not easy, and that it takes a long, long time to perfect this, but it's worth the wait. Paraspinal muscles. These are the small, short muscles that are involved with back pain and improper movement of vertebra more often than the large muscles. This shows the importance of specificity of intention when working to free vertebrae. Let's apply some of the principles that we were discussing in spinal mechanics when we were looking at the vertebra to the real body here. It's just a wonderful thing when you're working on somebody's back during a session that you can feel areas that you can relax at a very deep level with the very small muscles that move from transverse process to spinous process, from transverse processes to the transverse process above. All of these small little muscles are the ones that cause so much problem. And it's so important to not be doing perfunctory strokes on the whole back and really focus into the areas that you can have this person walk out of that session saying, wow, I've never felt this much freedom for a long, long time in that area. So let's talk again, keeping in mind with a quick review that the lumbar vertebrae basically articulated at an angle like this, the thoracic vertebra articulated at an angle like this, and the cervical vertebra articulated at an angle about like this. Remember this, because we want to apply force in a direction to free or mobilize vertebra along their planes of articulation. So let's talk about a few of the ways that you can work with vertebra. Realizing that the lumbars are like this, we can work with rotation by pushing on one side and the other. I often see therapists work bilaterally and symmetrically up the back. And when you do that, you can work with anterior-posterior movement or glide of vertebra, but you really can't do much with the rotation. And what I find for most people is that they rotate one way more easily than the other. So what I do is I actually can feel that Dina rotates more easily here on my left side than my right, and so I'm not going to try to mobilize her more into that position. I'm going to spend more of my time with my right hand. I may even totally take my left hand off that transverse process over there and maybe move one vertebra up and actually immobilize L3 by holding the transverse process so that my rotational force applied to L4 will free up the junction between the two vertebrae. One little thing you can also do with vertebra that are not working as smoothly as you'd like is to use different body parts. I'm going to go down and use Dina's leg as a lever to try to mobilize these lumbar vertebrae. This is an excellent way to try to free these vertebrae up. So I'm going to take care of my own back. I'm not going to lean forward too much. And I'm going to grab her upper leg. And now I can very specifically move her leg in such a way that I can feel that vertebra moving. The higher I lift her leg, the more I'm going to move her into extension. As I move it out, I'm going to be working on side bending. As I move this out, her vertebrae are actually bending to the side like this. And what you need to do is you need to go to the vertebrae that need the work. You have to be very precise. I'm not going to be taking a nice broad stroke here because that's not going to focus my attention to the particular vertebra I want to work on. Knuckles also work very well here. I've seen this demonstrated in sort of a perfunctory manner of just moving all the way up the spine and then going to the other side and going all the way up. You have to realize that very often some vertebrae are hypermobile, and they've become hypermobile because they are trying to take up the slack of ones that aren't moving. Let's move to the thoracic area to demonstrate a bit more of these mobilization exercises to work with the vertebra. So let's go down to the mid-thoracic, and my hands are right on the transverse processes. I can feel them right through these muscles. And let's talk about anterior-posterior glide of vertebrae. Anterior glide would be pushing straight down toward the table. And while I'm doing this, I noticed as one side move more easily. My right hand, right here, moves more easily, which means that there's a rotation this way. So the first thing for anterior-posterior glide, I'm going to push straight down with both hands. And remember that here in the thoracic area, the vertebra above is going to be resting on the vertebra below. So if I push straight down from directly above, I'm actually pushing this facet right into the facet of the vertebra below it. So it's going to be pretty hard for me to be doing much mobilization. What I want to do is I want to push the bottom vertebra and free it from the superior vertebra. So that way it can slide like this, I can rotate, I can do whatever I want to do. So for that reason, in the thoracic area particularly, I almost always work up toward the head. So I'm going to switch my body here. And now, as I'm pushing anterior-posterior, I'm on one vertebra and I'm pushing it away from the vertebra above. So what I'm doing is I'm pushing it down like this. Then, as I get more sophisticated, I can start working on rotation. I can push it down to open up those facets, and then I start working on rotation. So what I feel is that it rotates very easily in a clockwise direction, and it doesn't in a counterclockwise. So what I can do now is just put most of my emphasis in moving the other direction. I come to end range. Sometimes you come to end range and you just wait and see if it'll slowly start shifting. And this is what will relax those small muscles that are in contraction and spasm, trying to stabilize a vertebra that's already rotated. So the main thing is I'm not going to do this to every single vertebra. I'm just going to go to the vertebra that I'm feeling resistance at. And if I need to, I can use my knuckles. The main thing is I'm visualizing this articular surface. So if I start working on one side in rotation, this is what I'm going to be freeing here. The main thing I want to emphasize is that we have 24 vertebrae that articulate with each other in at least two places. So we've got 48 joints that we're dealing with in the spine, and it really is going to waste your time if you work the same way on each one of these vertebrae. So as you're taking your large strokes, if you're doing your nice broad strokes, if you're using your forearm, your knuckles, or anything, what you're looking for are the spots that aren't working. Some spots that are hypermobile, you're actually doing a disservice by getting them more mobile. What you want to do is work on the areas that need the work. It's a little bit like waiting for the bus. When I'm lying on the table getting a massage, and I've had this troublesome spot, and I just keep waiting for that massage therapist to get there, and then they'll move right on and do one quick move and move on to the next vertebra, and I feel like that bus that I've been waiting for has just driven by and hasn't seen me. So that's mobilizing vertebra. We'll go into the cervical vertebrae when we talk about the neck and talk a little bit more in detail about how they work. In addition to mobilizing and freeing the vertebra to move more freely, I think also that the ribs are another possibility of getting a lot of better movement in the spine and helping the breath of your clients. I find my clients and those of my students very, very much appreciate the work to the ribs. So let me demonstrate some of the movements that the ribs make. A lot of people don't realize how mobile they are. So if we take a look, right here, you of course can see Dina's ribs coming down here. Let me talk about the first movement, which is what I call the bucket handle. If you can imagine a bucket handle attaching in the back and in the front, the ribs actually on in-breath are going to roll up like this, and on out-breath, they're going to roll down. So you're actually going to have to work with the issue of, is this rib rotated this way? Is it rotated that way? If it's rotated toward the top with the bottom pulled out, you're going to feel a sharp edge of that rib when the person's lying down. We'll talk about dealing with that. If they're rotated the other way, then you're going to feel a sharp edge at the top edge of the rib. So this is the bucket handle, ribs moving up and down. The next would be the idea that when on your out breath, your hands are going to get closer together, and on the in breath, they're going to move apart this way. And then the other side of that coin would be that from front to back. On the out breath, hands move closer together. On the in breath, they move out. So you've got to be mobilizing these ribs at the sternum in the front and at the spine in the back. The other consideration is the ability for the whole rib cage to move with the spine in forward flexion and back this way in back extension. And many people exaggerate this posture. These ribs are actually rotating on the vertebra, and I often see people who overuse these posterior back muscles to lean almost backwards with a military posture. So they're pushing the mid-thoracic forward, and they're walking around with very, very tight back muscles back here. So let's address how to work with ribs in the prone position here. Let's apply some of these principles of rib movement to actually working on the body. I think you will find that if you gain some confidence and practice with ribs, it will be a great addition to your practice. So fairly high percentage, not probably at least 2 or 3 times a week I have somebody coming in with a rib that's really not working right. Remember, we're not putting ribs back in place. I really don't like using terms like this rib is out of place or something like that. That's for doctors to deal with. But we certainly can mobilize, and if the rib happens to move into a happier place where it stops hurting, then so much the better. Let's go down to the back here and talk a little bit more about the ribs. So I visualize the ribs as almost a piano keyboard here. Each rib should be able to work independently from the rib next to it. So as you push down, it's just be like playing the piano. 1, 2, 3, 4, all the way up. And what you'll find is that there are certain ribs that aren't moving well. And these are the ones that just sometimes 20, 30 seconds of work on can free up. And it's also the thing that if a client comes in with very specific rib discomfort, it hurts when they cough or laugh, you sometimes can be a great service, and 3 to 4 minutes of work on the rib will be all that's needed to return them to normalcy. So let's talk a little bit about the rib and try to pretend that we have just one rib here that is not really working very well. So there are several ways that it can be aberrant in its movement. One of the first things that I notice is that I'll feel an edge of the rib. So the bottom edge of this rib will feel sharp to me, where there's a nice indentation between the rib above and the one that we're working on. And it can just as easily be rotated this way. So what I normally do, just lateral to the transverse process, I'll find the troublesome rib, and we may even be able to see as I push up Dina's back how the ribs move, and then we get right here and that rib is not moving. So I'm going to work on this particular rib right here. First thing I do is just take both my thumbs here and follow that rib and try to get a sense to see if it's rotated. It's slightly rotated this way. I'm going to exaggerate. I feel the top edge of the rib better than I feel the bottom edge. So I'm then going to get on that rib with one of my thumbs on the top border and one on the bottom, and I'm just going to start like a teeter-totter rocking that rib. And it rocks very easily in this direction, and it resists me in this. Now, I'm not going to try to force through this and just cram that rib till it's even. Sometimes what you need to do is go into the rotational pattern, wait for that to soften, and then as you come back, you'll find that it rocks the other way more easily. Do about 3 or 4 repetitions of this, and that sometimes is all you need to move on. The other factors you can work with to sort of help these tumblers fall into place like you're picking a lock here is that you can distract the rib. So what I'm going to do is I'm going to sink right through that tissue and push that rib away from the spine and then work with it in the same manner. By the same token, compressing the rib into the spine sometimes can soften those muscles that are grabbing it. So I may even work this way and push it toward the spine. I'm keeping my body on this side. If I were actually working in this manner, I would be moving so I could be easier to push. And then you go back into that rotational pattern. And there we got a little bit of a melt, and that rib started moving there. One other way you can work, and side lying works fine for this, but you can just imagine there is you follow this rib down and you compress it. So I'm actually bringing the rib cage together here, and then have the client take some nice deep breaths. You get in with that pattern for a while. Do 3 or 4 breaths this way, and then on their out breath, you hold that rib in a compressed position, and on their in-breath, they're going to fight against that, and then you suddenly release it. And sometimes that rib will just free itself enough that things start working. On the other side, you can be very, very intuitive. I almost call this Ouija board working, with just working in large rib patterns, so you don't have to be just on a single rib. So what I'll do is I'll try to sink through with one hand and feel 7 or 8 ribs here. Actually, I'm covering almost the whole rib cage. I'm not really down to the floating ribs. And I'll just see if it wants to move in a counterclockwise or a clockwise direction. I'll go as far as it wants to go, and then I'll just start distracting or compressing that whole pattern into the spine and start moving this way. And this feels very, very good to your clients. It'll put them in a very relaxed state. And I had a student of mine. In one of my classes, I came in with a rib out, and he just studied this the day before for the very first time, and he did the best work I've ever had on getting a rib in. I'd had about 18 hours of discomfort, and he spent about 4 or 5 minutes just unwinding. Just be sure that you are directing your attention through the tissue, directly to the rib. As long as you don't try to get too active and force anything into its pattern, the body will sometimes tell you how to relax. Take some classes in unwinding. It's incredibly important work. I'll just add one other thing that is sometimes not mentioned in massage classes, and that is that you have these tiny, short little muscles that run all the way along the rib and attach each rib to the rib above and the rib below. These are, of course, your intercostal muscles. So you're going to want to be sinking through serratus posterior, through latissimus, and all these other major groups, and keep your fingers soft. I'm just going to use one hand so you can get a sense of this. And you just feel for fibrous areas along these intercostal muscles, and you sink, and you just wait. Use the breath, and just visualize that you're softening those muscles. This is very meticulous, time-consuming work. You're not going to want to try to cover every rib, but you will come to areas that you can really see that for one reason or another, an injury or something else, that the intercostals are involved, and be prepared to work on those intercostals. Sink through those deeper muscles and work on those intercostals. If you want to open up the ribs, all you need to do is take the arm up, and that's going to open them up. Make a little space in between the ribs. This is very fun work, and your clients will love it. Do practice this. One of the difficulties about doing a video about massage is that it just needs to be, by the nature of what we're trying to accomplish, a bit episodic and jumping around. I want to shift gears a little bit and work a little bit more like I might if I actually had a client here, incorporating some of the strokes and some of the theories we've been covering here. I do want to remind you that I'm not going to be taking as much time and care to integrate the left to the right, the back to the pelvis, but it should give you a little bit closer idea about how I work. I find in my classes very often at break time, I'll actually work on one of the students, and most of the students feel they get as much benefit from that as the specifics that they're trying to remember. So let's just begin on Dina's back here and see where my hands take me here. So I've already put lubrication on this back, so I don't need any more. I would be starting with some nice broad strokes here. At the same time, I'm feeling how do these ribs rotate, how do these vertebrae rotate, are there any areas that are blocked off? They're not working as well. And then right away, I come to one right here, and I'm going to shift gears. Now I'm going to take a nice broad forearm stroke. Start working with Dina's breath. See if I can do a little dance with her body on letting this go. I can try to override any holding pattern she has by some light work here, and then stabilize and sort of go into those deeper patterns and seeing if they let go. Notice that I can switch midstream. I don't have to continue all the way down the spine here. I could start moving to a little bit more of a cross fiber stroke on these external muscles. In the latissimus area, I'm feeling some fibrousness here. So what I'm going to do is just move to my fist and work when the muscle's in a somewhat shortened position. Remember that the latissimus adducts the arm, pulls it down to your side. So after I've softened that, I'm going to take Dina's arm and put it up above her head. If it feels like it's going to fall off, all I need to do is just block it with my leg here. Now, this latissimus has been 10-20% greater stretch here. So I'm actually giving some knowledge to this muscle to relax and lengthen rather than to just soften. Now move to my knuckles to work on the border of this scapula. So on this side you can see what I'm doing. I'm moving right along the border of the scapula here. After some of that specific work, I'm going to move into some broad work again to integrate this. I often try to cross joint lines in different sections of the body. So I'm going to be working with her crest here. Even though I've just been working up here, I can keep her arm in a stretch. And now I can just push her body down so that I get a little bit of side bend and I'm opening up that quadratus area. And I'm going to work with a fist on the quadratus. Can open up the other side the same way. Open up that area, carry it down. If I want to do some more specific work, I feel like right here in the lumbars it's a little tight. I'm now going to move to a knuckle. Be working along where the iliolumbar ligament is. At the same time, I'm going to be directing my attention to this transverse process of L4 here and work a little bit on rotating it and freeing it up. Soften the sacrum a little bit. And then return to an integrative stroke. I want to talk a little bit about the erector spinae muscles here. We covered this in the introductory tape about how to free muscles from entrapment down below. So what I'm going to do is I'm going to get on the medial border of her erectors here. And I'm not going to roll over them. I'm going to actually just pretend they're a guitar string I'm sliding, and then I'm going to slide it from the tissue down below. If my fingers start getting tired, I can use a little smaller segment. So I can just visualize that I'm getting these erectors so they can slide from side to side instead of being just glued down to the tissue down below. I can even take my knuckle along the side here if I want to, if my fingers are getting tired. Remember, I'm not sliding over this muscle. I'm just trying to free it from the areas below it. And then I'll do a nice integrative stroke here. Probably would go over to free the other side. Usually the rectors, if they're glued down on one side, are going to be glued down on the other side. And as I'm moving down here, I notice a rib right here that's really not moving. I need to differentiate. Is it actually a rib or is it a vertebra? So what I'm going to do is decide if it's a vertebra first by moving a little bit closer to the middle so that I'm on the transverse processes of the vertebra. And I feel it moves pretty well. This would be side bending, moving it. I push forward on one side and the other, and I feel it's pretty free. So then I slide outside of the transverse process and get on this rib, and now I'm working on the rib. Remember that the rib articulates on the anterior part of that transverse process. So now I'm going to switch with this. I'm going to rock it. See if I can pull it up a little bit. Compress it into the spine a little bit to see if that frees it. And just play with it. Your clients will notice this difference profoundly, as opposed to somebody that's just running over the back and doing a few strokes. If you don't have success in about a minute or so, it's time to move on. And I do feel some fibrous issue right here around the intercostals, so I'm going to switch gears again and really just try to sink in between these ribs. The rhomboid muscle. This muscle travels from the 7th cervical all the way down through the 5th thoracic. We will see the importance of this factor when we consider positioning the scapula in the following section. On the upper back, let's spend a little bit of time on the trapezius muscles and the rhomboids here. The key to putting a stretch on these muscles has to do with the scapula. With the arm down, the scapula is in a fairly neutral position, and what's going to happen is the upper fibers of the rhomboid are going to be fairly lengthened. So I usually try to work on the rhomboids in two different sections. I work on the upper fibers with the arm down, because the scapula is rotated this way and is pulling these upper fibers nice and long. So if I want to work in the direction of the fibers, I move this way. I can take my other hand and actually pull this scapula out a little bit farther to get a little bit more of a stretch here. Can work right along cross fiber along the upper border here of the medial side of the scapula. Somebody that had very, very wide pulled apart scapula, I'm not going to want to stretch them. They're wide enough as they are. In that case, I probably would be doing most of my work toward the feet, doing cross fiber work to soften up those fibers, but I wouldn't want to be lengthening them. If the scapula are pulled very close together, somebody with a military posture, then this is perfect. You want to let them let go so that those scapula can drift to the outside. When I want to work on the lower fibers of the rhomboid, then all I need to do is move this arm up, which is going to rotate the scapula this way, and now I have a lot of length in these lower rhomboids. We'll cover the scapula and the rotator cuff in another section in much more detail. After I've released the rhomboids, then maybe I want to get up to the upper trapezius muscles, in which case I want to have her arm down as far as possible to put a stretch here. And then work with whatever I want to. I very often use my other hand to just have a nice soft hold on the head here, and I can even rotate it slightly to get a little bit more stretch. And then there's a little bit of some ropiness here in the levator scapula area here. So I'm going to slow down, very much change gears, just sink and wait for a melt there. One of those things that I think is fairly irritating is when people, as I'm getting a massage, is when people feel that levator scapula and they just keep rolling over it and rolling over it. And that can get awfully tender and last for 2 or 3 days if you do too much of that. I think you're very, very better off after doing just a few of those to just sink and wait. And just wait for that tissue to soften. This is the key to working deeply, is don't get into a routine of always moving very, very fast. This might be a time that I would have Dina reach down with her hand to get a little more stretch there, and then that's going to work on the neurological component there, that's going to let loose a little bit. We will cover the neck later, so I'm not going to go into great detail, but don't just draw a line right across the top of the body and stop. Integrate this work. Come into the neck a little bit, do some nice work on the soft external muscles there, softening them, loosening them, maybe even feel some of the vertebra and do some rotation or side glide, some bending there. Integrate your work across body part lines. After I've done that specific work, then I'm going to come out to a more superficial level and take some longer integrative strokes. The main point I'd like to get across is that there's no set regimen for ever working on the back. Don't get hung up on working bilaterally, because that's going to prevent you from noticing the rotational patterns that you have. And make each new back that you're working on a bit of a chess game here, so you can decide what are the areas that I can, in a relatively short amount of time, give this person some more freedom in their spine. Most of us spend about 80% of our back work with our client in the prone position. And it is an excellent way to work on the spine, and it offers a lot of possibilities for leg movement and arm movement to put the body into stretch. But I do want to cover the side lying position to show you a few other options that I think are extremely worthwhile. One of the problems with the prone position for the back is that at best you're going to stretch muscles into a neutral position, and a lot of times those back muscles are very, very tight, and if you can somehow bend the person into a position to put a stretch on those muscles, then they will actually walk off the table and have a lot more length in those posterior muscles. This would be the normal side-lying position, and I'm going to have Dina bring her head down as far as she can and her knees up as far as she can, and now you can see what a great stretch we have on these muscles here. So I'm going to start at the upper end and just do some work in the rhomboids, and I would continue this all the way down the back. If I feel particular areas that are very, very tight, then I would move to knuckles. I'd get far enough back that I can lean into this and keep my elbow straight and do repeat strokes. If I want to make sure that I've got some more length in the rhomboids, I can just take Dina's arm and have it reach all the way out here, which will pull this scapula way forward so that I can actually work on serratus posterior and some of these other muscles that are very often not covered and that you certainly wouldn't be covering in the prone position. Move down to work in the lats this way. And if I want to put a little stretch on them, I just move her arm up a little bit. This is particularly important for people that have a sway back or an extensive lordosis. And all you need to do here is just make sure those legs are as far up as they can. And you can see this great stretch of tucking this pelvis under here. And then I'm going to work with my fingers, because if I use my forearms or something like I normally would use, my body would be in the way. But all I do is I just give this cue here to tuck this pelvis under. And I'm stretching all this compacted lumbar fascia here. By the same token, people that are thoracic breathers or have military posture and really are short in this area because they stand up very, very tall and erect, this is a great place to get in. And I can just take my hand here as a brace for my elbow and work down this way. This also is a very handy place for the window wiper stroke I've talked about. I take my hand and I just place it on the side here, and then with a nice broad stroke, I can cover a great area of the back here. I can do repeat strokes. The farther I have my hand away, the more specific my strokes will be. So I have about half the surface area working on Dina's back now as I did when my hand was 3 inches nearer to her body. The C curve is an excellent, excellent position. The other side of the coin from the people that you want to move into a C curve and really stretch the lumbar fascia are the people that have rather flat lower backs. And they have difficulty tilting their pelvis forward, and you can really do them a favor by getting more of a swivel going in the hip, just if you're moving at an angle down with an axis like this, that the pelvis can go under and it can also go back. A lot of people really jam up in this area right here when they try to turn their pelvis back. So why don't you watch my hands, and I'm going to have Dina bring her legs back and her head back, and she's moving from flexion into extension. There. Now, Dina does this rather easily, but a lot of people, you're going to feel a lot of catching, and what you want to do is you don't want to move them into too much extension. You can vary the amount of curve that you have to the spine by how far you bring back the leg. But you can really increase the areas up here. You can get some length so that this pelvis can turn under this way, and you can get some curve in that spine there. Put the lumbar spine in a position of extension, and I can start working on that fascia to actually just move the opposite direction of what we did with the C curve. Just do nice slow work. You're not forcing vertebrae into positions they don't want to be in, but this can be a very freeing position. And this would be a good position for somebody that's really slumped forward in the diaphragm, that's in an external breathing pattern where they're really pulled forward into a big kyphosis here. So you're not going to want to work on them in a C curve because they've already got a big kyphosis. You want to straighten that spine as much as possible, so you pull these legs back, and then you start working in this position. Feel any vertebrae that are not working, get in on those vertebrae. Just try to free them up, get some movement in there. And of course you could work all the way up the spine here. Remember that you need to help vertebra move into flexion and extension. We're not always moving just in one direction. You need to take into consideration a person's postural pattern. Definitely a good area to be working on the gluteals, the upper gluteals, gluteus medius, gluteus minimus. And you can just accentuate things by turning this pelvis under. In addition to the variables of flexion and extension, the side lying also offers a really, really wonderful way to work with rotation of the spine, which is particularly important with tennis players, golfers, or anyone else that's just gotten a little bit stiff with the rotational aspects of the spine. So let's start in a neutral position with Dina, and I'm going to demonstrate what I'm trying to do. Basically, I'm going to try to move in oppositional directions the pelvis and the rib cage. So I'm going to have Dina's pelvis rotate this way by bringing her top leg forward. So now it's tilted at an angle as opposed to being straight up. So we've got a bit of a tilt there. And then with her rib cage, instead of being straight up, we want it to tilt this way. So basically we're getting almost like wringing a wash rag. We're going to go this way with one and the opposite with the other. So now I'm going to take Dina's arm and get a little bit of a stretch by pulling it back this way. Now I can get a wonderful stretch all the way up Dina's spine here. I can do a nice broad stretch. And this would be the way you'd, of course, start out, and then you'd feel like, are there any areas of this spine that are not moving? She's actually quite flexible in her lumbar area, and a little bit here in the thoracic as a pattern we've seen. It isn't as much. So I'm going to get a little more focused here. If I'm doing a big broad stretch, this flexible component is going to be doing all the bending. So what we want to do is we really want to localize it at the area that it's not. So I'm going to localize this stretch in the mid-thoracic by bringing her top ribs back and her bottom ribs forward on this side. And then I can become much more specific. Again, I'm going to use my thumb as a fulcrum, and I'm going to try to bend one vertebra and rib complex forward. At the same time, I'm going to bring the other one back. So I'm almost like wringing a wash rag again. I'm going to be moving back this way and forward with the right hand. I can play around with lengthening as I do this, with compressing. How can I talk to this body and tell this area to let go? After I've done some specific work, then I want to integrate that with some broader work. I can just run right down the spine with my knuckle. And then, as I've mentioned, Dina is actually pretty mobile down in her lumbars, but you can just sort of imagine that if I were to be pushing on the transverse process of one lumbar and then on the spinous of the other, that I can be working on freeing these vertebrae up here. Remember, in the thoracic, since the top vertebra is going to be over the other one, if I push on the bottom vertebra, I'm actually pushing it away from the top, and I can really mobilize this. So you can be as specific or broad as you want. If you wanted to be doing just a quick stretch, then you just take a nice broad stroke and work like this. I'd recommend when people feel how good this feels that you say, well, there's a few areas that are a little stuck here. Let's do a little more detailed work. Okay. Let's move to just the opposite position. So what we're going to do now is we want Dina's pelvis, instead of being an angle like this, we want to move it the opposite direction. And instead of having her thoracic area being rotated back at an angle like this, we want it to swing forward in the opposite direction. So Dina, why don't you take your top leg and bring it back. And bring the other one forward. She's anticipating me. That's great. And then I want her actually, because this is tilting this way and I want this to go the other, I'm just going to have her top arm reach over the table in the front, and now we're going in the opposite direction. Okay? After you've done a few strokes here, you can start increasing that a little bit by doing a stretch. I'm pulling this pelvis back while at the same time I'm pushing the rib cage forward here. And then I can actually accentuate this by having Dina bring her bottom arm behind her and down low right back here. And bring your arm all the way down there. And now just let yourself just roll over there. And now we've got an excellent stretch here. You can see all the possibilities here. This is just really opening up this posterior rotation of this pelvis. At the same time, I can be moving up this way to increase it this way. Once you become comfortable with these rotational variations in the side lying, it can be even more fun to become inventive and try to work out other alternatives that maybe afford you even more mobility. So I would wait until you're feeling comfortable with the regular static side lying rotational poses, and after you're there, then try to move to something else that can better serve your client and yourself. So what I'm going to do here is try to add to that rotation by lifting Dina's leg and putting my hand from the front all the way through to the back so I can use this arm as a lever arm. Just move my body, and the more I do that, the more extension I'm going to have, and the lower I bring her down, the more I'm going to rotate this pelvis back. So I'm going to let her leg come down. I'm going to use my hand as a nice fulcrum here. It's very, very easy to do this. It's just resting right on my arm here, and then I can do some very, very specific work in this area to increase that mobility. There we go. So Dina let go a little bit there. You can do some broad strokes if you want, although I think the precise vertebral articulation strokes are the most effective here. But this is going to feel very good for somebody that's a dancer, that does yoga, that does a rotational sport. This can really help their mobility. Have fun with your work. Become inventive. You don't want to get stale. Every client you should work on differently.